General anatomy of joints. Joints are those regions in the body where two or more bones or cartilages come together. That union is called joint. In the last episode, we spoke about bones, and in that we saw the bones are the ones responsible for giving rigidity and structure to the entire skeleton. From that point of view, joints can be said to be those areas which are the weakest parts of the entire skeleton, since there is no bone over there. But then, this very weak area has been transformed into an area of advantage, where the two bones are joined together to form a joint, and the joint imparts varying degrees of movements. So, those weak areas are converted into areas of strength because movement is imparted. Now, let's talk about some observations that we made. Bones and the place of contact for joint formation. Long bones unite at their ends, flat bones unite at their edges. The short bones, on the other hand, unite at their surfaces, and then so do the sesamoid bones. They also unite at the surface. The next observation is bones form joint, but how? Flat bones with larger surface areas unite by fibrous joints. Long flat bones, where the length is more than the width, they unite by cartilaginous joints. The long bones, the short bones, the sesamoid bones, they unite by synovial joints with the neighboring bones. Parts of a young long bone unite by cartilage. The irregular variety of bones unite by a combination of joints, whereas the pneumatic bones unite by fibrous joints. How are the joints classified? Well, it depends on which way you look at it. If you see the functional classification where the focus is on amount of movement, then you can classify the joints into immovable, slightly movable, and freely movable joints. The immovable ones will be called synarthrosis, slightly movables will be called amphiarthrosis, and the ones which are freely movable will be called diarthrosis. If you see the structural classification, which is based on the material binding the two neighboring bones and whether there is presence or absence of a joint cavity, then you can have fibrous joints, cartilaginous joints, and synovial joints. So let's talk about the fibrous joints. Fibrous joints are mainly seen in the region of skull. Here, the bones connected by a band of dense regular connective tissue which we call fibrous tissue. There is no joint cavity, and these are slightly movable or not movable at all, because here primary function is not imparting movement. Primary function here is imparting stability, strength. There are three further subtypes of fibrous joints. We have sutures, syndesmosis, and then we have gomphosis. First of all, the sutures. These are seen only between bones of the skull. Fibrous tissue, the one that serves to join the two bones together, gets continuous with the bone's periosteum, the surrounding. And it is seen that many such unions ossify and fuse in the middle age, and hence now after fusion they'll be technically called as synostosis, that is bony junctions. Depending on the edge shape and morphology, the two edges of bones which are coming in contact, these sutures can further be subdivided into plain suture, serrate suture, denticulate suture, squamous suture, and shindylisis. So the plain suture will have two plain edges of neighboring bones making a joint, whereas in the serrate variety you have zigzag interlocking edges of the two neighboring bones which unite securely. In the denticulate variety, as the name suggests, we have the margins of the bone uniting shaped in the form of tooth-like projections, which securely again interlock because of their reciprocal curvature and display. The squamous suture, on the other hand, has plain surfaces to offer, which are partially overlapping each other, making the union stronger. And the shindylisis variety is basically a crest and a groove type of union. Uh, the plane, the serrate, the denticulate, the squamous, these sutures are seen in the skull wall, whereas shindylisis is a type of joint which is seen towards the base where the ala of the vomer articulates with rostrum of the sphenoid. Moving over to the next variety of joints, syndesmosis. Syndesmosis literally means union by ligament. Here, the bones are connected by ligaments only. The amount of movement depends on length of the fibers. So, longer are the length of the fibers, the more movement one can expect. Now, where do you get these syndesmosis? You get the syndesmosis in the form of the interosseous membrane of the forearm and the interosseous membrane of the leg. So there is a joint through this fibrous suture or fibrous structure between the radius and the ulna and between the tibia and the fibula. Those syndesmosis impart a limited degree of movement. The next variety is gomphosis. Now, gomphosis is a peg and a socket type of joint, and it is exclusively seen in the human body, where the teeth are joining, the roots of the teeth are joining in their bony socket. Now, that junction between the root of the tooth and its containing socket is by way of series of fibrous ligaments. We call them periodontal ligament. These periodontal ligament not only secure the root of the tooth to its socket, but they also act as shock absorbers to absorb the impact forces during chewing movements. So those are the three types of fibrous joints. We have the sutures, the syndesmosis, and the gomphosis. Moving over to the second category, the cartilaginous joints. Here, the articulating bones are united by cartilage. They usually lack a joint cavity and they are not highly movable. In the cartilaginous variety, we have two further subtypes. We have synchondrosis and symphysis. Synchondrosis are also called as primary cartilaginous joints, and the symphysis are also known as the secondary cartilaginous joints. Now, out of these two, primary cartilaginous joints are the temporary ones, whereas the secondary cartilaginous joints or symphysis, they are the permanent joint. What do we mean by that? Well, let us see. Synchondrosis literally means junction of a cartilage. Here, the hyaline cartilage unites the two neighboring bones. The joint is essentially immovable, and the examples are epiphyseal plates present at the long bones. Once the total final length of the long bone has been achieved, this epiphyseal plate of cartilage is going to go away, and the epiphysis and the diaphysis are going to unite together. That's what it means by saying primary cartilaginous joints are temporary ones. On the other hand, the secondary cartilaginous joints, which are called symphysis, literally mean growing together. Here, fibrocartilage unites the bones. These joints are slightly movable. Because of the presence of fibrocartilaginous plate, they are better at absorbing shocks and also provide strength and flexibility. So here, the hyaline cartilages are present on the articular surface of the bones, and those two are separated from each other and at the same time united with each other by a plate of fibrocartilage. Examples: intervertebral disc, pubic symphysis. It is said that the secondary cartilaginous joints are to be found along midline of the body. They are here to stay, so we can call them they are permanent joints, unlike the primary cartilaginous ones which are temporary. Well, that brings us to the most mobile variety of joints, the synovial joints. They include most of the body's joints. They are diarthrodial, that is freely movable, and all contain a fluid-filled cavity called the joint cavity. Let's see the general structure or general features of a synovial joint. The first feature to be talked about, to be seen, is articular cartilage. The articulating bones are covered with a thin plate of hyaline cartilage that acts as a spongy cushion for absorption of compression and protects the ends of the bones from being crushed against each other. It also tries to create an ice on ice effect when the bone move over each other. Second point would be presence of a joint cavity, which is also known as a synovial cavity. Well, this synovial cavity is actually a potential space since the joint cavity is filled with small amount of synovial fluid, which serves to lubricate the area and also creates ice on ice effect between the two articulating bones, which will be moving over each other. The third feature of typical synovial joint or the synovial joint as such is going to be articular capsule or joint capsule. It is usually two layered. It has got an outer layer and an inner layer. The outer layer is a fibrous layer consisting of dense irregular connective tissue. It gets continuous with the periosteum of the surrounding bones and it is there to impart strength. The inner layer, on the other hand, is a synovial membrane, which is a loose connective tissue layer as compared to the outer one, and this layer makes synovial fluid that constantly lubricates the two articulating surfaces as well as the joint cavity. The synovial membrane lines all internal joint surfaces that are not covered by the hyaline cartilage. Feature number 4 would be synovial fluid. This synovial fluid, which is secreted by the synovial membrane, is actually a dialysate of blood, that is ultrafiltrate. It contains special glycoproteins and hyaluronic acid. It is there for the nutrition of the cartilage and functions as a slippery lubricant. Point number 5 or feature number 5 is reinforcing ligaments. They are the capsular ligaments, which are the thickened parts of the capsule, which can be present either intracapsularly or extracapsularly. Their function is to strengthen the joint and prevent unnecessary or unwanted movements. Next feature is nerves. The synovial joints are richly supplied with nerves. They are there to detect pain and monitor stretch, which is one of the ways of sensing posture and body movements. So the capsule is richly nervous. Next one is blood vessels. There is a periarterial vascular plexus which richly supplies blood to the articulating surfaces and the joint tissues. Extensive capillary beds can be seen in the synovial membrane that are there to constantly produce this ultrafiltrate or dialysate. Now, in some of the synovial joints, we have articular discs or menisci, which are made up of fibrocartilage. Now, these are present at all such locations where the articular surfaces are not fully congruent, or there are different shapes that are coming in contact with each other and hence they are fitting poorly. In order to increase the congruence of the area of contact, the menisci or articular discs are seen. The examples are the knee joint, the temporomandibular joint, the sternoclavicular joint. These discs or menisci might partially or completely divide the joint cavity into compartments. There are bursae and tendon sheaths also present in the vicinity of the joint. These bursae and those tendon sheaths, they contain synovial fluid. They act like ball bearings. They are principally there to avoid friction. The stability of the synovial joint is principally dependent upon the articular surfaces, the ligaments, and the muscle tone. Shape of the articular surfaces usually plays a minor role unless and until there are deep sockets or deep grooves involved in formation of that articulation. The joints are not solely dependent on articular surfaces. Ligaments, the stronger factor to keep the joint stable. They can stretch but only minimally. The muscle tone, it's a constant factor and it keeps the tension in the ligaments in place within the range, and muscle tone as a factor for joint stability is more important for all such joints which are structurally weak. Say for example, for shoulder joint, for the knee joints, and the arches of the foot. These are the areas, these are the places, these are the joints where tone of the muscle assumes much more importance for the stability of the joint. The synovial joints are classified by their shape of articular surfaces into plain synovial joint, hinge synovial joint, pivot synovial joint, ellipsoid synovial joint, condylar synovial joint, saddle synovial joint, and ball and socket synovial joint. The plain synovial joint variety, where the bony surfaces are flat or slightly curved, they allow only gliding movement. Rotation is prevented by the ligaments present in the vicinity. Examples are intercarpal and intertarsal joints. Next variety is hinge synovial joint. There is a convex surface of bone that looks like a pulley. It fits into a reciprocally concave surface of the other bone. It is essentially a uniaxial joint like a door hinge, and it allows movement only across one axis in one plane. The example is an elbow joint. The movement allowed by this elbow joint, which is a hinge variety of synovial joint, is a flexion and an extension. The pivot joint is also an uniaxial joint, is known for allowing rotatory movements. In a pivot joint, there is a central bony peg which is surrounded by osteoligamentous ring, where either the central bony peg revolves or the peripheral osteoligamentous ring moves around the central bony peg. Examples are the proximal and the distal radioulnar joint. In the ellipsoid type of synovial joint, there is an oval convex male articular surface that fits into an elliptical concave female articular surface. Movements are possible across two axes. The example of a typical ellipsoid joint is a wrist joint, which allows for flexion, extension, and abduction and adduction set of movements. The condylar or bicondylar variety of synovial joint, where there is an oval-shaped depression that fits into a reciprocally curved projection. It is biaxial, allows flexion, extension, abduction, adduction if possible. The typical examples cited are the metacarpopharyngeal joints, and the bicondylar variety typical example cited is the jaw joint, that is a temporomandibular joint, where elevation, depression, and side-to-side movements are permitted. The saddle variety of synovial joint, the articular surfaces are concavo-convex and in reciprocal curvature with each other. It is a biaxial to start with, but it also allows some rotational component. Example of a saddle synovial joint is the carpometacarpal joint of the thumb, also known as trapezio-metacarpal joint. Here, in addition to flexion, extension, abduction, and adduction, rotational component is also allowed. And finally, the last and the most mobile variety of synovial joint is a ball and socket synovial joint, where there is a spherical ball fitting into a cup-shaped socket. Classical examples cited for ball and socket joints are the shoulder joint and the hip joint. They are essentially multi-axial and they allow movement across many different axes. For the sake of description, we describe them into flexion, extension, abduction, adduction, medial and lateral rotation. When you combine these movements in a sequence, you can describe the arc of a circle, and that is called a circumduction. Well, that's the general anatomy of joints for you. Happy learning!